What is the primary purpose of using binders in tablet formulation? A. To disintegrate the tablet. B. To lubricate the tablet. C. To bind powder particles together. D. To improve the taste. Answer. C. To bind powder particles together. Binders are used to ensure that the tablet holds together after compression, preventing the powder from breaking apart. Which of the following is an example of a disintegrant used in tablets? A. Starch. B. Magnesium stearate. C. Talc. D. Polyethylene glycol. Answer. A. Starch. Disintegrants like starch help tablets break down into smaller fragments in the digestive system, enhancing dissolution and absorption. What is the term for tablets that release the active ingredient over an extended period? A. Immediate release tablets. B. Extended release tablets. C. Sublingual tablets. D. Effervescent tablets. Answer. B. Extended release tablets. Extended release tablets are designed to release the drug slowly over time to maintain consistent blood levels. What is the function of lubricants in tablet manufacturing? A. To reduce friction during tablet compression. B. To increase tablet hardness. C. To improve the taste. D. To promote dissolution. Answer. A. To reduce friction during tablet compression. Lubricants prevent the tablet material from sticking to the machine, allowing smooth compression and ejection. Which method is used to produce tablets by compressing powder into a solid form? A. Wet granulation. B. Direct compression. C. Lyophilization. D. Coating. Answer. B. Direct compression. Direct compression is a process where powders are compressed directly into tablets without the need for granulation. Enteric-coated tablets are designed to A. Dissolve immediately in the mouth. B. Dissolve in the stomach. C. Dissolve in the intestines. D. Dissolve in water before consumption. Answer. C. Dissolve in the intestines. Enteric-coated tablets are designed to bypass the acidic environment of the stomach and dissolve in the more neutral pH of the intestines. Which of the following is a common filler used in tablet formulation? A. Lactose. B. Sodium chloride. C. Sodium lauryl sulfate. D. Gelatin. Answer. A. Lactose. Fillers like lactose add bulk to the tablet, ensuring it is of sufficient size for handling and consumption. What is the purpose of using a coating on a tablet? A. To improve the tablet's appearance. B. To mask the taste of the drug. C. To control drug release. D. All of the above. Answer. D. All of the above. Tablet coatings serve multiple functions, including taste masking, improving appearance, and controlling the release of the drug. Sublingual tablets are placed A. Under the tongue. B. On the skin. C. In the rectum. D. In the stomach. Answer. A. Under the tongue. Sublingual tablets dissolve quickly under the tongue, allowing the drug to be absorbed directly into the bloodstream. Which of the following is a commonly used tablet disintegrant? A. Crospovidone. B. Glycerin. C. Mannitol. D. Sorbitol. Answer. A. Crospovidone. Crospovidone is a superdisintegrant that helps tablets break down quickly when they come into contact with moisture. What is the process called where tablets are coated with a thin layer of sugar to improve appearance and taste? A. Enteric coating. B. Film coating. C. Sugar coating. D. Compression coating. Answer. C. Sugar coating. Sugar coating is an older method where tablets are coated with layers of sugar for appearance and taste masking. It also increases the tablet's bulk. What does the term bioavailability refer to in the context of tablet formulation? A. The ability of a drug to dissolve in water. B. The fraction of an administered dose that reaches systemic circulation. C. The rate at which a tablet disintegrates in the stomach. D. The amount of drug in the bloodstream. Answer. B. The fraction of an administered dose that reaches systemic circulation. Bioavailability refers to how much of the active drug in a tablet is absorbed and available for use in the body. What type of tablet is designed to dissolve slowly in the mouth and is often used for cough relief? A. Sublingual tablet. B. Buccal tablet. C. Effervescent tablet. D. Lozenges. Answer. D. Lozenges. Lozenges are tablets that dissolve slowly in the mouth and are often used to deliver drugs like cough suppressants. Effervescent tablets are designed to A. Dissolve under the tongue. B. Be swallowed whole. C. Be chewed. D. Dissolve in water before administration. Answer. D. Dissolve in water before administration. Effervescent tablets are dissolved in water, releasing carbon dioxide to form a fizzy solution before consumption. What is the main purpose of diluents in tablet formulation? A. To bind particles together. B. To facilitate tablet breakdown. C. To increase the volume of the tablet. D. To control the release of the drug. Answer. C. To increase the volume of the tablet. Diluents are used to increase the size of tablets when the active drug is present in a very small amount, making them easier to handle and swallow. Which of the following is commonly used as a lubricant in tablet formulation? A. Magnesium stearate. B. Starch. C. Microcrystalline cellulose. D. Lactose. Answer. A. Magnesium stearate. Magnesium stearate is a widely used lubricant in tablet manufacturing to reduce friction and prevent sticking during compression. What is the function of glidants in tablet manufacturing? A. To enhance tablet disintegration. B. To improve powder flowability. C. To increase tablet density. D. To act as a preservative. Answer. B. To improve powder flowability. Glidants improve the flow properties of powders, making it easier to compress the material into uniform tablets. Which of the following is a characteristic of a chewable tablet? A. Designed for slow dissolution in the mouth. B. Meant to be swallowed whole with water. C. Designed to be chewed before swallowing. D. Dissolves in water before consumption. Answer. C. Designed to be chewed before swallowing. Chewable tablets are formulated to be chewed and swallowed, often used for pediatric or geriatric patients for ease of administration. What type of tablet is designed to dissolve in the cheek pouch, where the drug is absorbed directly into the bloodstream? A. Sublingual tablet. B. Buccal tablet. C. Enteric-coated tablet. D. ODT, orally disintegrating tablet. Answer. B. Buccal tablet. Buccal tablets are placed in the buccal cavity, cheek pouch, and are absorbed directly through the mucous membrane into the bloodstream. Which of the following is a common issue in tablet manufacturing that causes uneven color distribution on the tablet surface? A. Friability. B. Capping. C. Lamination. D. Mottling. Answer. D. Mottling. Mottling is a defect in tablet manufacturing where the tablet shows uneven color distribution, usually due to improper mixing of colorants or ingredients.